On this episode, we will talk about why am I so passionate about this. We'll also talk about applying creams and lotions on your incisions, and we'll talk about taking pills or crushing them. Hello everyone, I'm Dr. Alvarez with Endobariatric.com, and welcome to episode 214 of the AskDrA show. And thank you for being part of the show. If you're new to the show, let me explain really quick on how we work. If you're into weight loss surgery and gastric sleeve and weight loss in general, you're welcome to send me your questions using the hashtag AskDrA, and that's the hashtag right here. And you can do that along anywhere, social media. We'll be able to grab your questions, add them here to show, and I'll be here more than happy to be here with you and answer them. And if you're into this content, I might suggest you subscribe to our channel. That way you don't miss any of our future episodes. All right, so let's get into the show. Okay, so this is a common question I get, and I should be doing this question as an FAQ because it's so frequent. And patients asking, why am I so passionate about this, or why do I like bariatric surgery, weight loss surgery, or why did I decide to go into weight loss surgery? And the truth is, I started my career, I wanted to be a doctor like my dad, and I went into the surgical field being a general surgeon because my dad's a surgeon as well. But at the end of the line, I deviated toward bariatric surgery, weight loss surgery. My dad's a gastrointestinal surgeon, and initially he wasn't that happy about it, but I saw a really good field of being able to help a lot of patients out. And I would see obesity take a toll on my family. I saw my mom, I saw some aunts. I mean, it was in my family, and definitely taking a toll on prediabetes, high blood pressure, other conditions. And I really saw when I was in general surgery training how weight loss surgery had a tremendous impact on a patient's life. Not just the physical aspect, but also the mental aspect, society, every aspect of the patient's life. So back then, when I was in training, I didn't see any other area in medicine having that much impact on a patient's life other than like oncology, like giving chemotherapies and saving a patient's life from cancer. Very impactful, a lot of impact on the patient's life. But then bariatric surgery, such as much big impact on the patient's lives. You would see the transformation, and it was way different than just general surgery. General surgery, don't get me wrong, I really love general surgery, gallbladder, the appendix, a hernia surgery, but I would see it would end there. That would be the end of the treatment. I mean, if you have appendicitis, you come to general surgery, I remove your appendix, treatment, and resolved. And that's it. It would have no more impact. But here, with weight loss surgery, you would craft the patient's procedure, and the transformation would start there. The impact would start there and transcend for months and years for the rest of the patient's life. So that's why I became so passionate. I became a bariatric surgeon. I helped my mother's, I did my mother's surgery, and then I did a whole bunch of family members, nieces, aunts, in-laws, I mean, you name it. And this is my passion. I really, really love crafting these sleeves for my patients and seeing how it evolves and how that patient just blossoms. That's why I love it so much. All right, so the second question is, Doctor, I would really love to know how or when can I apply some creams and ointments. And we talked about this before, but it's been a while, so it's a good time to refresh this. So once you have your surgery, we do this laparoscopically with very tiny and small incisions. And those incisions, best advice I can give you is just leave them there, don't mind them, regular soap and water, and just keep them dry. So being there, no special ointments or creams on for 15 days. After 15 days, that incision is healed, it's dry, and then you can apply whatever you want. You can skin guard, Mederma, lotion to get moisturizer lotion, and etc. So no applying like creams, special ointments, or anything like that for the first 15 days. Let your incisions heal nicely and dry. Yes, you can get them wet. Hey, not underwater, all right? And so avoid submerging underwater, bathtub, swimming pools for 15 days as well. But yes, you can take a shower, pad dry, put your shirt on, and just let it be for 15 days. And the last question is, I want to know if I need to crush my pills. There are some pills that are not supposed to be crushable, or put them apart, like those extended release pills. Don't cut them, don't crush them. Pretty much nowadays, there are hardly any pills that you can't take. And where I tell patients to be very careful are big horse pills, solid pills, not capsules. You might have a big capsule. I'm not concerned about those, because capsules have that enteric coating that once it reaches your stomach, your sleeve, it'll disintegrate and it'll release the medication. It's not a big concern there. But a big horse pill, like a big, I'll give you an example, big vitamins, I would suggest you start with chewable or liquid form until you're 2 or 3 months out. After that time, you can pretty much take whatever type of pill, capsule, it won't be an issue at all. But those first 2 or 3 months, I would suggest you go with liquid vitamins or chewable vitamins. And it doesn't mean you need to stop at 2 or 3 months. You can continue, if you like the gummies, you can continue with that for the next year or so, or continue on them. It doesn't matter. But take your supplements. And do not crush or do not cut those extended release capsules or pills. If you need or you have a special need, contact your surgeon, contact your doctor, your primary health physician, to see if there's an alternative for this. But clear your questions, show a picture of your tablet, bring your capsules or tablets, your pills with you at the time of surgery. Ask them. I love when my patients tell me, this is what I take, these are the ones they give me at the pharmacy, these are the capsules, these are the sizes. Can I take them? Yes. Here, red flag on this one. I would suggest you try a different form on this one, all right? So that's the best way to do it. Your own particular case, see your doctor, your surgeon about this, and we'll be more than happy to help you out with that. If you like the show, you like the content, if you can leave me one of these, it'll be greatly beneficial, and it supports a lot the channel, all right? Hey, don't forget to send me your questions. Hashtag AskDrA throughout social media. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.